in some, the threat level's high. It's really very high. In fact, it's probably the highest level that we've seen in the past several years. The threats we're most concerned about are those which disrupt patient care and patient safety, specifically high impact ransomware attacks, which have had a regional and sometimes even a statewide impact on patient services. And based upon publicly available data provided by HHS's Office of Civil Rights, we're seeing at this moment in time, we're at 331 breaches impacting 32.4 million individuals. And the nature of those breaches really fall into three categories. The first type of breach that we're seeing are the traditional data theft attacks. Second type of breaches, we're seeing an increase in third-party attacks, basically cyber adversaries using business associates to come in and attack hospitals and health systems, and supply chain type risk. Third and most significant concern for us are ransomware attacks that have increased dramatically, targeting hospitals and health systems. The COVID-19 pandemic has really exacerbated the situation by providing much more of an attack surface for the bad guys because of the increased use of telehealth, telemedicine, remote workforce. And of course, all the hospitals and health systems are dealing with reduced resources to deal with the increased attacks due to a loss of revenue and shortage of highly trained cybersecurity professionals.
I think the best way and the first thing that I would focus on is really to identify what is normal so you can understand what's abnormal. And by that, I really mean, what are those procedures, processes, what are those system things that you need to be looking at to identify what normal and what good looks like, so that way you can identify the bad and be able to do that in a quick, succinct fashion. So I think an example of identifying the abnormal is really to baseline, let's say, an inpatient clinical role. So a nurse, right? A nurse working in the EMR is an example, right? In your medical record system. If that nurse is doing certain kinds of behaviors and certain kinds of transactions on a day-to-day basis, you should be able to baseline that. And there's tools available to do that and help you with that. But ultimately, identify what that behavior looks like, and then put monitoring and instrumentation in place that actually says, hey, something doesn't look right. Maybe this nurse is starting to, or this nurse or job role is starting to do thousands of transactions in an amount of time that's just not possible. So that could indicate either a system problem, right? It could also indicate, maybe just poor training or some sort of issue going on, or it could be a compromised account.
It's incredibly important for all the owners and operators in the healthcare space to understand what systems they have that keep them up and running, from the systems that allow them to check in patients at the front desk of the hospital, to the systems that ensure that ambulances are getting to the right types of facilities that allow patients to have the best care. These are all systems that are increasingly operating in an online environment, and that means they're susceptible to cybersecurity risks. And so all owners and operators need to know how these environments are working and how these systems are potentially at risk from cybersecurity actors, in order to ensure that they can provide smooth and continuous care to all of their patients. It's also incredibly important that senior leaders know what the key metrics are that they want to hear about when it comes to cybersecurity, and that they're getting briefed on these regularly. Any good information technology department is seeing tons of risks every day, and senior leaders don't necessarily need to hear metrics on every single type of issue that is facing our IT leaders, but they do need to understand the types of metrics that they're going to hear about on a regular basis in order to benchmark their own organization.